بالله السميع العليم من الشيطان الرجيم بسم الله الرحمن الرحيم نحمده ونصلي على رسوله الكريم أما بعد. Welcome again, dear viewers, to Medicine and Islam, a program sponsored by Sharjah Television that features topics relevant both to the field of medicine as well as to the great religion of Islam. For the last couple of weeks, we've been talking about prostate cancer, which is on the rise throughout the world, but especially in the West. And we concluded our program last week talking about the fact that in countries where men stand and urinate, the incidence and the rate of prostate cancer is very high. And in countries where men sit and urinate, like in Muslim countries and in Asian countries, the incidence of prostate cancer is very low. So this is a very important theme because it brings home the barakat and the blessings and the hikmah and wisdom and the sunnah of the Prophet, peace be upon him, when we know that we should sit, when we urinate. We should not stand. We want to start off today talking about risk assessment in this last and final part of our three-part mini-series. Many prostate cancers are not destined to be lethal, and most men will ultimately die from causes other than of the disease. Decisions about treatment type and timing may therefore be informed by an estimation of risk that the tumor will ultimately recur after treatment and or progress to spread and metastasize and cause mortality and death. Several tools are available to help predict outcomes such as pathologic stage and recurrence after surgery or radiation therapy. Most combine stage, grade, and PSA level, and some also add the number or percent of biopsy cores positive, age, and or other information. Treatment. Treatment for prostate cancer may involve watchful waiting, surgery, radiation therapy, including brachytherapy, and external beam radiation, high-intensity focused ultrasound, chemotherapy, cryosurgery, which is freezing, cryo means to freeze, hormonal therapy, or other combination of the above. Which option is best depends on the stage of the disease, the Gleason score, which is a way of measuring the stage of the disease, and the PSA level. Other important factors are the man's age, his general health, and his feelings about potential treatments and their possible side effects. Because all treatments can have significant side effects, such as erectile dysfunction and urinary incontinence, treatment discussions often focus on balancing the goals of therapy with the risk of lifestyle alterations. The selection of treatment options may be a complex decision involving many factors. For example, radical prostatectomy, which is removing the prostate after primary radiation failure, is a very technically challenging surgery and may not be an option. This may enter into the treatment decision. If the cancer has spread beyond the prostate, treatment options significantly change. So most doctors who treat prostate cancer use a variety of nomograms to predict the probability of spread. Treatment by watchful waiting, HIFU, radiation therapy, cryosurgery, and surgery are generally offered to men whose cancer remains within the prostate. Hormonal therapy and chemotherapy are often reserved for disease which spreads outside and beyond the prostate. However, there are exceptions. Radiation therapy may be used for some advanced tumors, and hormonal therapy is used for some early-stage tumors. Cryotherapy, which is freezing the tumor cells, hormonal therapy, and chemotherapy may also be offered if initial treatment fails and the cancer progresses. What about active surveillance? When I first read this, it sounded like a term out of a CIA movie, espionage, active surveillance. But it's a medical term also. And it makes sense because the tumor is a slow-growing tumor. So you don't have to, in the early stages, panic. You can treat it and you can wait and see what happens. This is active surveillance. is observation and regular monitoring without invasive treatment, without getting aggressive in your treatment. Active surveillance is often used when the early stage, slow-growing prostate cancer is found in an older man, especially in older men. Conversely, watchful waiting may also be suggested when the risks of surgery, radiation therapy, or hormonal therapy outweigh the benefits. So the older you are when you develop the prostate cancer, the less aggressive you should be, because, the older you are, the more side effects you have from surgery, the more side effects you have from chemotherapy, the more side effects you have from radiotherapy, and they may actually cause more harm than good. And you're already at a higher risk factor of dying from heart disease or some other type of cancer if you're over 70. So if the cancer is a slow-growing cancer, then you can just kind of leave it alone and treat it, conservatively, with just medication. For younger men, however, a trial of active surveillance may not mean avoiding treatment altogether, but may reasonably allow a delay of a few years or more, during which time the quality of life impact of active treatment can be avoided. Published data to date suggests that carefully selected men will not miss a window for cure with this approach. Additional health problems that develop with advancing age during the observation period can also make it harder to undergo surgery and radiation therapy. Now, what about natural therapy? As an alternative to active surveillance or invasive treatments, which does nothing to change the course of disease. A growing number of clinicians and doctors and researchers are looking at non-invasive ways to help men with apparently localized prostate cancer. Perhaps most convincing among this group are Dean Ornish, MD, and colleagues, previously made famous for showing that aggressive lifestyle changes can reverse atherosclerosis, which is hardening of the arteries. These results have so far been under a 2-year treatment. Many other single agents have been shown to reduce the PSA, showing PSA doubling times, or have similar effects on secondary markers. For instance, I found this interesting. 8 ounces of pomegranate juice per day, okay, which is a very strong antioxidant, gives you about 60 milligrams of antioxidant, can reduce the size of the tumor in the prostate. So pomegranate juice, this is conservative, natural, alternative medicine, treatments. Pomegranate juice, 8 ounces per day, very effective. The potential of using multiple such agents in concert, different types of herbs and so forth, also is beneficial. A more thorough review of natural approaches to prostate cancer has been published. Surgery. Surgical removal of the prostate, or a prostatectomy, is a common treatment either for early stage prostate cancer or for cancer which has failed to respond to radiation therapy. The most common type is a radical retropubic prostatectomy, when the surgeon removes the prostate through an abdominal incision. Another type is radical perineal prostatectomy, when the surgeon removes the prostate through an incision in the perineum, the skin between the scrotum and the anus. Radical prostatectomy can also be performed by laparoscopy through a series of small 1 centimeter incisions in the abdomen, with or without the assistance of a surgical robot. Now, what about the radical prostatectomy? It's effective for tumors which have not spread beyond the prostate. This is for tumors that have not spread. Cure rates depend on risk factors such as PSA level and the Gleason rating. However, it may cause nerve damage that significantly alters the quality of life of the prostate cancer survivor, with loss of urinary control and loss of sexual function. These are the 2 things that you can have as a result of that. You're alive, but you may have trouble controlling your urine, and you may have